Hello and welcome to Potty Talk 101. Today we're talking about constipation in babies, specifically babies. I know that lots of kids struggle with constipation. This video is just talking about babies. So what does it look like in infants or babies? This is going to be painful bowel movements, baby is crying, baby's having a hard time pushing bowel movement out, or infrequent bowel movements, or when you change them, you notice they have small hard pellets after they have a bowel movement. Often this happens if your child has a slower GI system or if they're transitioning to solid foods. This is really common. Sometimes if your child has a sensitivity to a new food that they've started, sometimes you can notice some constipation as well. So let's talk about what's normal. Okay. So what's normal? Normal for a child 0 to 3 months who is being breastfed is anywhere between 5 and 40 bowel movements per week. That comes out to roughly 2.9 bowel movements per day. If your child is 0 to 3 months and they're being formula fed, they have a little less frequent bowel movements, still about at least 5 per week, but anywhere between 5 and 28 bowel movements per week. So that comes out to about 2 per day. As your child is older, the norms change a little bit. So if they're closer to that 6 to 12 month range, they should definitely be within that 5 to 28 bowel movements per week, which comes out to about 2-ish per day once they've hit that 6-month mark. So next we're going to talk about some activities that we can do in order to promote the GI system and kind of get those abs turned on a little bit so that we can encourage the bowels to move smoothly through the GI system. Last thing I want to say before we sign off today is if your baby is still having issues, you've tried some of the activities, your baby's really good at tummy time and maybe they can do all of these activities, definitely talk to your pediatrician. We definitely want to have them on our side as far as making sure that your child is getting the right dietary intake. Thank you for tuning in. Drop some comments below. Let us know if you have any questions or if you want more information on this topic or other topics that you might be interested in. Thanks for watching Potty Talk 101.